Welcome to the Pension Board's presentation on the UCC Medicare Advantage Plan with RX. The Pension Board operates at the intersection of faith and finance by supporting and empowering ministry in the United Church of Christ through leadership initiatives and direct financial support, but also in creating high-quality products, services, and benefit plans for clergy and lay church workers. In this video, we will discuss the UCC Medicare Advantage Plan with RX, administered by Humana, that went into effect January 2021 for Medicare-eligible clergy, lay employees, and family members. We will explain the process and reasoning for making the transition from a self-employed plan to a fully insured plan with Humana, highlight what makes the plan so valuable, and answer some frequently asked questions. Let's begin.
Hi all.
Welcome, Reverend Margaret. I'm glad you can join us for our discussion today.
I wouldn't miss it. I've got some questions of my own.
I'm glad to hear it. We'll get to your questions shortly. Reverend Margaret, the UCC Medicare Advantage Plan with RX is a Medicare Part C plan. To understand what that is, let's do a quick overview of Medicare. Medicare is the federal insurance program for people who are age 65 or older and for younger people with disabilities. There are 4 parts to Medicare. Part A helps cover the cost of inpatient hospital stays, care in a skilled nursing facility, hospice care, and some home health care. Part B helps cover the cost of certain doctor's services, outpatient care, medical supplies, and preventative services. Part C, Medicare Advantage, is offered by private companies and includes Part A and B, and usually Part D. The plan may also offer additional services such as discounted fitness programs, some vision, hearing, and dental services. Part D helps cover the cost of prescription drugs, including many recommended shots and vaccines. Now that we quickly reviewed Medicare, let's discuss how the pension boards went about transitioning plans and review the highlights of the new plan.
Yes, that was one of my questions. Could you explain what led the pension boards to a plan transition? Also, what was the process for making the decision?
Reverend Margaret, that is a common question we receive. First, the pension boards felt it was prudent to plan for future medical and pharmacy claims. Specifically for pharmacy claims, certain life-saving treatments such as gene therapy and stem cell medication could cost upwards of $1 million.
$1 million? My heavens!
Passing these expenses to Humana allows the pension boards to reduce cost uncertainties while maintaining the long-term sustainability of the plan. Second, the pension boards needed to adjust for an older average age of plan participants. Since medical costs tend to accelerate later in life, the older average age of plan participants was projected to have a more significant burden on the old self-insured plan over time. The transition to Humana allowed us to be part of a larger pool of participants and allowed us to transfer risk to Humana. Thirdly, the pension boards wanted to make the plan more competitive, more affordable, and help encourage more retirees to join the plan. We heard specifically from many of our younger retirees. They said that they were pleased with the flexibility and range of services offered by the old plan, but its relatively high costs presented a financial challenge. As you will see in a bit, the move to Humana reduced costs for many participants and added additional benefits, such as coverage when traveling overseas and coverage for gym memberships.
I can see now that a lot went into this decision.
Yes, that's true, Reverend Margaret. The transition to Humana took about 2 years from start to finish, and it was done after great analysis and expertise by the pension boards and an independent healthcare consulting firm. In January 2019, the Pension Board's Benefits Committee was tasked with investigating alternatives to a self-funded plan for the decision points we just discussed. In July 2019, the pension boards hired Buck Global LLC, an independent healthcare consulting firm, to investigate alternatives and present these alternatives to the pension boards. Buck interviewed and analyzed 5 major healthcare providers. The pension boards eventually received in-person proposals from the 2 finalists. In February 2020, the Pension Board's Benefits Committee selected Humana to administer the UCC Medicare Advantage with RX. The new plan went into effect on January 2021. For those who are not familiar with Humana, here are a few important facts to know. Humana is a proven nationwide leader in providing Medicare Advantage plans and has consistently earned a 5-star rating with the Centers from Medicare and Medicaid Services. Humana has a nationwide physician, hospital, and pharmacy network and has a proven track record in providing Medicare Advantage plans to over 8.8 million Medicare beneficiaries across all 50 states for more than 30 years. This makes Humana a reputable choice in servicing our UCC Medicare population.
What are some of the advantages to the new plan over the old one?
That's a great question, Reverend Margaret. There are many advantages of the Humana plan over the old plan. For example, from plan year 2020 to 2021, monthly premiums decreased approximately 30% and annual deductibles decreased by about $60. Annual open enrollment was available without a statement of health for enrollees that have had a break coverage or have never been in plan. One nationwide premium rate is offered with no age rating. There is no coverage gap. There is coverage for in-network and out-of-network services. Reduced complexity. Just one ID card for hospital, medical, and pharmacy versus 3 ID cards in the past. The new plan covers services while traveling internationally. The new plan includes new benefits, including a fitness benefit through SilverSneakers and a wellness program where you can earn gift cards for healthy choices, such as an annual wellness exam, volunteering, and staying active. We will discuss these benefits in more detail in a bit.
Wow! I didn't realize that Humana offered so much. I'm in for those cash rewards.
And as you should be, Reverend Margaret, the wellness program provides an incentive to keep our members healthy and on track with their fitness goals.
I have another question. What if my doctor does not participate with Humana? How will this impact me?
It's important to understand that the Humana plan is a PPO, which stands for Preferred Provider Organization. A PPO allows participants to receive care in-network or out-of-network care. Under the UCC Medicare Advantage plan with prescription drugs, participants pay the same whether a provider is in-network or out-of-network, as long as the provider takes Medicare and agrees to bill Humana. If your doctor is out-of-network and does not participate with Medicare, Humana will cover the same amount for that service as in-network provider. However, it's possible your responsibility may vary. To help illustrate this, here is an example. Let's say you are going to an in-network provider. Your provider will bill Humana for the contracted rate of that service, and Humana will pay 96% of that rate. You are responsible for the other 4%. For example, let's say a service costs $100. Humana will pay 96%, or $96, and you are responsible for the remaining 4%, or $4 in this case. If you are out of network and your doctor does not participate in Medicare, Humana still pays the same amount to the doctors. Using the same example above, Humana will pay $96 to the provider. If your provider charges, let's say $110 for this service, then your share will be $14. You may also be required to file a claim on your own behalf when visiting an out-of-network provider. It's always recommended to confirm your financial responsibilities for a service prior to receiving it so you are clear. If your provider is out of network, you can research providers in your area that are in network. If you want to remain with your out-of-network provider, ask your provider for the amount that you are responsible for before receiving the service. This will help you plan from a financial perspective. Go to humana.com/physician finder to search doctors in your area.
You make a very good point. It is my responsibility to inquire what my potential costs will be if I go out of network.
Now remember those new plan benefits I mentioned earlier? Let's discuss them now, starting with Humana's Go 365 program, where you can earn gift cards like these shown here. You can earn rewards just for taking simple health actions such as getting a physical, volunteering, and staying active. The list of activities changes over time, so visit humana.com and click on Go 365 to register and learn more.
So what do I have to do? Move a little to earn points?
That's right. In addition, SilverSneakers is a total health and physical activity program that helps you get fit and stay fit the way you want. By providing access to over 16,000 fitness locations nationwide. SilverSneakers also provides access to virtual classes and outdoor activities. Visit silversneakers.com/start here or download the SilverSneakers Go app.
Hold on, I'm getting my body ready to exercise. 1, 2, 3, 4.
Also, with MyHumana Mobile App, your health is at your fingertips. You can receive personalized health information, find a doctor, arrange for a virtual telehealth visit, compare drug prices, and access digital ID cards. Reverend Margaret, do you like hospital food?
What? No! Ugh!
Nobody does. But with Humana Dine, you're eligible for up to 28 nutritious meals delivered to your door at no additional cost to you. If in the event you become an overnight inpatient in a hospital or skilled nursing facility, visit humana.com for more details. Finally, I thought you would be interested to read what some of our members are saying about Humana. For example, monthly premium reductions, along with other benefits offered by Humana, have been helpful. Very pleased with the ability to get medications delivered to my home. Love Humana. Let me just tell you, love it, love it, love it.
I'm liking what I'm hearing and seeing so far. Where can I learn more about the plan?
To learn more about the plan, visit www.pbucc.org. Click on Pension and Benefits, UCC Medical Benefits Plan, then click on the Medicare Advantage Plan on the left side menu. You can also contact Member Services at 1-800-642-6543, Monday through Friday from 8:30 a.m. to 5:30 p.m. Eastern Standard Time, or email us at info@pbucc.org. For additional questions, contact Humana at 1-866-733-1972, Monday through Friday, 8 a.m. to 9 p.m. Eastern Standard Time, or visit humana.com.
Great information. Thank you so much.
You're welcome, Reverend Margaret.
I'm going to get my sneakers and start walking. This program has inspired me.